Meningocele is nothing but, you can break down the word as meningo plus cele, which is protrusion or herniation of the meninges. Whereas a myelomeningocele, in this case what happens is the protrusion takes place in both the spinal canal and the meninges. There is another condition called as a pseudo-meningocele, in which it is a leakage of CSF that causes a kind of a protrusion, which in fact is not a protrusion of the spinal cord. Now let's see one example of where a physician does a laminotomy along with a facetectomy and a foraminotomy of two lumbar levels. This can be reported as 6:30:30 and 6:30:35 for the next additional interspace. So whenever we mean like levels, we actually mean the interspaces, and you have to look out for the assignment of modifiers as left or right or the bilateral modifiers depending on the laterality where the surgery is being performed.